This session will be an overview of nursing informatics. At the end of this session, you will be able to define nursing informatics in key terminology, discuss the evolving roles and competencies of nursing informatics practice, and describe how clinical information technologies may impact nursing practice. The term informatics was derived from the French term informatique, which means to refer to the computer milieu. The Health Information and Management Systems Society defines informatics as the discipline concerned with the study of information and manipulation of information via computer-based tools. Nurses in all settings and areas of practice are considered knowledge workers. The foundation of nursing informatics conceptualized the process of knowledge generation in nursing. The conceptual framework underpinning the science and practice of nursing informatics centers on the concepts of data, information, knowledge, and wisdom. Nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. Nursing informatics supports consumers, patients, nurses, and other providers in their decision-making in all roles and settings. This support is accomplished through the use of information structures, information processes, and information technology. The goal of nursing informatics is to improve the health of populations, communities, families, and individuals by optimizing information management and communication. To understand the foundations of nursing informatics, we must look at its metastructures, science, concepts, and tools. Metastructures are the predominant concepts used in theory and science. Also of interest are the sciences that support nursing informatics, concepts and tools from information science and computer science, human-computer interaction, and ergonomic concepts, as well as the phenomena of nursing. In the mid-1980s, Bloom introduced the concepts of data, information, and knowledge as a framework for understanding clinical information systems and their impact on healthcare. He did this by classifying the then current clinical information systems by the three types of objects that these systems processed: data, information, and knowledge. He noted that the classification was artificial with no clear boundaries. However, increasing complexity between the concepts existed. Drawing on this work, Nelson in 2002 defined wisdom as the appropriate application of knowledge to the management and solution of human problems. Data, which are processed to create information, and then knowledge, may be obtained from individuals, families, communities, and populations in the environment in which they exist. Data, information, knowledge, and wisdom are of concern to nurses in all areas of practice. For example, data derived from direct care of an individual may then be compiled across persons and collected for decision-making by nurses, nurse administration, or other health professionals. Further accumulation of data may address communities and populations. Nurse educators may create case studies using these data, and nurse researchers may access aggregated data for systematic study. An example of data, information, and knowledge would be: data is vital signs for an individual's heart rate, the respirations, temperature, and blood pressure. Information is a serial set of vital signs taken over time, placed in a context, and used for longitudinal comparisons. Knowledge is the recognition of a pattern or identification of interventions, reflects information synthesis or knowledge that is based on nursing knowledge and experience. Wisdom is the accuracy of the synthesis of information and appropriate selection of interventions. A significant contribution of Graves and Cochran in 1989 was the description and definition of nursing informatics that was widely accepted in the field in the 1990s. It stated that nursing informatics is a combination of nursing science, information science, and computer science to manage and process nursing data, information, and knowledge to facilitate the delivery of healthcare. The central notion was that the application of these three core sciences was what made nursing informatics unique and differentiated it from other informatics specialties. However, other sciences may be equally as critical depending on the issue at hand. For example, if the informatics nurse specialist is dealing with a systems implementation in an institution, an understanding of organizational theory may be relevant to successful implementation. As science evolves, it may be necessary to include other core sciences in future models. Although the core sciences are foundational to the work of nursing informaticists, The practice of the specialty is considered an applied science rather than a basic science. The combination of science creates a unique blend that is greater than the sum of its parts, a unique combination that creates the definitive specialty of nursing informatics. Further, informatics realizes its full potential within healthcare when it is grounded within a discipline. In this case, the discipline is nursing. Computer and information science applied in isolation have less impact than if applied within a disciplinary framework. Through application, the science of informatics can solve critical healthcare issues of concern to a particular discipline. Many of the tools used by the informatics nurse and informatics nurse specialist are based on metastructures and concepts that incorporate knowledge from nursing and other health information sciences. Nursing knowledge is gained by the ability to extract data that specifically defines nursing phenomenon. Many different languages and ways of organizing data, information, and knowledge exist based on different concepts. The creation of nursing taxonomies and nomenclatures has occurred over the past years, allowing these iterations to occur. The American Nurses Association has formalized the recognition of these languages and vocabularies through a review process of the Committee on Nursing Practice Information Infrastructure. At a higher level of structure, several resources have been developed to facilitate interoperability among different systems of concepts and nomenclature, meaning different systems can communicate with each other. For instance, the systemized nomenclature of medicine, SNOMED CT, is considered a universal healthcare terminology and messaging structure. And using SNOMED, it enables terminology from the Nursing Diagnosis Association, NANDA terminology, Nursing Intervention Classification, NIC, and Nursing Outcome Classification, NOC. On a larger scale, the Unified Medical Language System of the National Library of Medicine incorporates the work of more than 100 vocabularies, including SNOMED. The informatics nurse must be aware of these tools and may be called on to understand the concepts of one or more languages and the relationships between related concepts and integration into existing vocabularies for a given organization. Computer science focuses on the study of theoretical foundations of computation processes and of practical techniques for their application in computer systems. Information science is an interdisciplinary science concerned with collection, classification, manipulation, storage, and retrieval, as well as dissemination of information. Human-computer interaction, usability, and ergonomics are of fundamental interest to the informatics nurse specialty. Essentially, human-computer interaction deals with people, software applications, computer technology, and the ways they influence each other. Elements of human-computer interaction are rooted in psychology, social psychology, and cognitive science. For example, an informatics nurse specialist assesses an application before purchase to determine whether the application design complements the way the nurse cognitively processes medication orders. A related concept is usability. Usability deals with specific issues of human performance during computer interactions for specific tasks within a particular context. Usability addresses the efficiency and effectiveness of an application. For example, a nurse informatics specialist might study the ease of learning an application, the ease of using an application, or the speed of task completion and errors that occur during application use when determining which system or application will be best used on the nursing unit. Ergonomics is used in the United States to describe the design, implementation of equipment, tools, and machines related to human safety, comfort, and convenience. Commonly, the term ergonomic refers to features of physical equipment or to principles of arrangement of equipment in the work environment. For instance, an informatics nurse specialist may have a role in ensuring that good ergonomics principles are used in an intensive care unit to select and arrange various devices to support workflow for cross-disciplinary providers and patients' families. Human-computer interaction, usability, and ergonomics are related concepts, so they're typically included under the rubric of human factors, or how humans and technology relate to each other. The overall goal is to better design for software, devices, and equipment to promote optimal task completion in various contexts or environments. Optimal task completion includes the concepts of efficiency and effectiveness, including considerations about the safety of the user. It is essential that the informatics nurse specialists understand these concepts to be able to develop effective strategies to select, implement, and evaluate information structures and informatics solutions. The importance of human factors in healthcare was elevated with the Institute of Medicine's 2001 report. Before this, the human-computer interaction and usability assessments and methods were being incorporated into healthcare at a slower rate. In the past 5 years, the number of human-computer interaction and usability publications in healthcare has increased substantially. Vendors have installed usability laboratories and incorporated usability testing of their products into their systems' life cycles. The Food and Drug Administration has mandated usability testing as part of its approval process for any new devices. Thus, human-computer interaction and usability are a critical concept for informatics nurses and informatics nurse specialists to understand. The meta-paradigm of nursing concept comprises 4 key concepts: nurse, person, health, and environment. Nursing actions are based on interrelationships between the concepts and are related to the values nurses hold relative to them. Decision-making is the process of choosing among alternatives. Nurses make decisions about interventions from their unique perspectives, and the decisions that nurses can make can be characterized by both the quality of the decision and the impact of the actions resulted from those decisions. As knowledge workers, nurses make numerous decisions that affect life and well-being of individuals, families, and communities. The process of decision-making in nursing is guided by the concept of critical thinking. Critical thinking is the intellectually disciplined process of actively and skillfully using data to conceptualize, apply, analyze, synthesize, or evaluate data and information as a guide to belief and action. Nurses' decision-making is described as an array of decisions that include specific behaviors and cognitive processes surrounding a cluster of issues. For example, nurses use data transformed into information to determine interventions for persons, families, and communities. Nurses make decisions about recommendations for addressing those problems. They also make decisions in collaboration with other healthcare professionals such as physicians, pharmacists, or social workers. Decisions may also occur within specific environments such as executive offices, classrooms, and research laboratories. Decision support systems are computer applications designed to facilitate human decision-making process. Decision support systems are typically rule-based using a specific knowledge base and a set of rules to analyze data and information and provide recommendations. Other decision support systems are based on knowledge models produced directly from the data regression and classification models that predict characteristics or outcomes. Recommendations take the form of alerts, for example, calling user attention to abnormal laboratory results or potential adverse drug events, or suggestions, for example, appropriate medications, therapies, or other actions. An expert system is a type of decision support system that implements the knowledge of one or more human experts without human intervention. For example, an insulin pump that senses the patient's blood glucose level and administers insulin based on those data is a form of an expert system. Whereas control systems implement decisions without the involvement of the user, decision support systems merely provide recommendations and rely on the wisdom of the user for appropriate application of these recommendations. Within informatics, there is always a tension between which decisions should be automated and which decisions require human intervention. An informatics nurse specialist must be able to navigate the complexity of the relationships between the following elements and understand how they facilitate decision-making: data, information, knowledge, wisdom, nursing science, information science, computer science, and other science of interest to the issue at hand, for example, cognitive science, nurse, person, health, environment, and information structures, information technology, managing and communicating information. The future of nursing informatics will impact and will be impacted by several driving trends. These include 1, changes in society such as the aging population and the increased use of participatory and mobile technology. 2, changes in healthcare delivery, including the changing and expanding role of the nursing within healthcare delivery. And 3, changes in technology such as nanotechnology, which promises to redefine the composition of nearly every human-made material and drastically alter biomedical applications. All of these changes will drive increased dissemination of informatics concepts and solutions into mainstream nursing and healthcare practices. As informatics solutions become as common a tool as the stethoscope, every nurse, to be safe and effective, will need to incorporate informatics concepts into all aspects of practice. One example is the increased recognition of the concept of wisdom as a key concept for nursing informatics. Its more detailed definition and measurement will be a part of the future of practice of all nursing. Nursing informatics is an emerging nursing specialty that combines nursing science, information science, and computer science. Informatics practices support nurses to effectively and safely care for patients as the information that they need is made more readily available. Nurses have always been actively involved in this field since computers were introduced to healthcare. And with the introduction of electronic health records, it became apparent that nursing needed to develop its own terminology, and nursing informatics has been instrumental in this process.